Hey, I'm here with Dr. Ariel Schwartz, my mentor. So this is a very special Foxed In podcast. Thanks for coming on,
Thank you
Doctor.
for having me, Jeremy. It's
Of,
great to be here with you.
of course. I can't believe it. I've known you. I've been working with you in some capacity since 2018
Hmm.
because that's when you signed my book, your great EMDR book with Barb, the EMDR therapy and somatic psychology, which such a necessary branch in trauma therapy, somatic work. I mean, and you've got a new book out, which we'll talk about, the practical guide to a practical guide to complex PTSD. It's absolutely awesome. So I wanted to open it up and really hear from you what you wanted to get out there today. I know I sent you a few questions online, and if you want to dive into those, if whatever you want to talk about, I'm really game for.
I'm really happy to talk about your questions, and I
Okay.
think I'd love to keep our talk relevant to what's happening in our world today.
Absolutely. I thought the same thing after I sent that. I was like, oh, we could really make this relevant now. So yes, sounds great.
And yeah, and it's so interesting. I mean, I'll share one of my own realizations that came about through everything that's been coming. So, just to contextualize for our viewers, this is July 3rd, 2020, and
Yeah.
we are still in a version of shelter in place, even though there's some premature, and I'm going to call it premature opening, happening in the U.S. right now that has led to huge surges in COVID. And we're also simultaneously inside of the, kind of this double intensity is what I'll call it, this double
Mm-hmm.
transformational intensity of what COVID has put us into simultaneously to George Floyd and the emergent awareness of systemic racism that has it's not new, there's nothing new about this, but it has just brought forward to our consciousness how systemic this is at all levels, and that even within the field of psychology this systemic racism and white supremacy exists, and that what for me personally came forth is that I've been writing about complex PTSD for years, right? And I have not thoroughly addressed the impact of ongoing. I mean, I've certainly addressed it. We have a whole chapter on cultural trauma in the EMDR and somatic psychology book.
Right.
We've certainly addressed it, but I feel like it's still in a blind spot for me, and as well as within the field of psychology, to discuss that as a form of complex PTSD. So that's been my process right now, is really integrating that not only into my own thinking, but into the book that I'm currently working on.
Well, that's a good teaser. I mean, I think it's definitely necessary. You're completely right. The difference between complex and ongoing trauma versus acute stress is so palpable, and that's what I've been talking with people about, is that the COVID lockdowns and feeling oppressed. I mean, so many different things that are chronic and people don't really have an answer to, versus kind of a fight or flee thing that happens and then they kind of reset and can go back to baseline. So with systemic racism, that issue of there not being a baseline of normals of healthy treatment, and I like where you're going with that, because I think it really draws some attention to some important things.
Yeah. Important things that have been here for so long, and that it's kind of like it's been banging on the door, and then with COVID and with the pandemic, it exposed the inequality at a whole nother level economically, and who was at greater risk because of the essential jobs, and the nurses and the people working cleaning the hospitals who
Yes.
were themselves at risk and their families are at risk. And I'm saying it in past tense, but it's current, it's now, it's here in Texas, it's here in Florida. And the economic impact on those who were already living in poverty, and then have this on top of it. The homeless community, who's impacted so severely. Community in jails, as well as our elderly. So a lot of the people that are living in vulnerable populations already, who have then been made more vulnerable.
Yeah, absolutely. If one good thing comes out of it, it's bringing attention to some already existent issues. I mean, absolutely. So tell us more about that. Where do you think interventions or improvements need to go? And we can link that also into the things that the questions I sent you. But I really don't want to rush any conversation you want to have on this.
Yeah, I think that that a huge part of it is awareness, that the more that we bring awareness to our own participation, our own reactivity, our own reliance or the benefits of privileges that we don't even realize that we have or pay attention to, that we recognize that actually we have something to lose and it's worth losing, because we need to recognize that by pushing for our own gains, for to keep ourselves ahead, and I'm speaking as a white woman here, but to keep myself ahead, which in somehow puts my voice center and marginalizes or decentralizes somebody else's voice, then I want to be aware of that, right? That how do we share this platform? And so even here to spend time in our conversation about this is to say this is my responsibility too. It's ours. Yeah. And and to put that more, that awareness and that onus here, that for me, so much of my own practice as a somatic practitioner, and reading my grandmother's hands, this beautiful book that's out there that's bringing together polyvagal theory and somatic psychology and trauma work and intergenerational trauma work together. And it's a beautiful piece of work, and to understand how we all have that responsibility to understand what happens in my body. And here's where polyvagal comes in, right? To
Yeah.
understand where reactivity shows up. And then it's nobody else's responsibility. I'm not the victim of that reactivity. I now have to take charge of it and to work with what happens inside of me so that I can be more available for the conversation, even if it's a hard conversation with another.
I think in the world of therapy in general, it can be very difficult for people to hear how there can be improvements, especially if people feel like they're already going so far. But when it comes to on a more qualitative level, the changes to make and just being a better listener and being aware that things aren't the same for some communities or others, I think that's a great place to go. I had on an African American psychologist a few weeks, at this point, it's probably a few months ago. Um, and she was talking about how just curiosity about how different communities are affected, like how African American men are not going to, let's say, respond to the same kinds of therapeutic cliches and culture that's kind of emerged in the echo chamber. Um, kind of, I say affectionately, like the live, laugh, love stuff. It doesn't always hit. Like we have to adapt therapy to different populations, and that's part of the job. And that's in grad school, learning about different populations and their unique struggles. We have to apply that into where we go, and it's so easy to get caught in a rut of a particular way of um, doing therapy, and it's so multifaceted.
Yeah, it's so true. It's so true. I think that um, being client centered, being, culturally sensitive, it's a conversation and it's a listening to what works with the individual, what works for the individual. When someone comes in, it's, there are so many influences within the field of psychology. I mean, we're at a stage right now where there's over 400 different therapeutic modalities, if
Yeah.
and that's probably a well outdated number, right? And so, but the good news about that is that therapy isn't a one size fits all.
Right.
Yeah.
Right.
And while I love EMDR, and of course that's how you and I met, and I love somatic psychology, and that's what I speak about so much, it's not an agenda. Not I can't we can't approach this in that way.
Right. Absolutely. I make sure to catch. It's very interesting. Like you have to catch. Well, am I seeing these EMDR targets in this person's life and wanting to jump into that work when they're not done telling their story on a one-to-one level, and they're not really interested or able to right now process that, right? I think that's a real mark of therapeutic awareness, is if you can avoid seeing to a hammer every problem is a nail, right? And if you can avoid going to that mode where everything is a trauma target, everything is this or everything is that, EMDR works amazingly, but you have to have that rapport and not apply it as one size fits all, like you just said. Yeah.
Yeah. And, we need to know. The other thing, I had this conversation with a consultation group this week where we were speaking about an individual experiencing a discrimination in their current relationship, in their current world,
Okay.
right? Experiencing ongoing chronic racism, right?
Yeah.
And discrimination. And so often when we're doing trauma work, we rely upon this phrase, which is, it's over now, right? Like we can orient to safety here and now because the event is no longer happening. But
Right.
when we're talking about chronic traumatization and they are not currently safe, we have this real dilemma. And one of the pieces that I spoke about, and this is in the EMDR and somatic psychology book in our chapter on cultural trauma, is that even in the context of ongoing chronic traumatization that's not over, we can still build the resources to feel empowered in the here and now, and then use those resources to reflect on how do we want to face the barriers and the obstacles that are real, that are around us here and now. And whether this is related to discrimination and oppression, or whether this is related to COVID and the ongoing stress of that, I feel like these empowerment techniques and these resources are really important day-to-day practice. I know for myself that I have been needing to engage in self-care like never before. You know?
Absolutely. Well, and I try to, yeah, this is a time where therapists have to walk the walk more than ever and not just talk the talk. And so it gets into this area of like going and exercising outdoors, doing things, whatever you can to get back to some sense of normalcy while being safe and respecting others, obviously. And I like what you just said, because it just brought me to mind of so many clients that I've worked with who, let's say, have had DV situations, and not just like in a romantic relationship, by the way, but adult children who live with their parents and can't afford to get out right now, and it's like there's a cultural element, like an intergenerational family, and there's abuse going on. It's like doing EMDR with someone like that can help, and it recharges them, and it's all about putting coping skills into the here and now that they then carry into the future. So when you said that, it resonated very strongly with me, because I think anyone who's gone beyond basic EMDR training, or when they get done with the basic training and the nice kind of in the training wheels environment of that basic level 1 and 2 training, you start to see it's not as always as easy as it's over now, it's done. It's not always like a fluke car accident or a mugging or something, which those are horrible, but they're sometimes a one-off compared to a lot of times our clients bring these chronic situations, that word again of chronic stress versus acute, of how am I going to build up resilience to get through this long-term and be realistic about it, but not fatalistic. And of culture and issues of abuse and ongoing just trauma from situations people can't always just snap their fingers and get out of.
Yeah.
So very excellent point. And that's in your book, like your book, A Practical Guide to Complex PTSD, which I'm going to put a link to in the video and the podcast, is so targeted toward clusters of symptoms, right? I'm pivoting to that because it's like you just talked about building resilience. Well, that book discusses healing invasive and intrusive symptoms. It breaks everything down. So whatever someone's dealing with, their healing strategies, literally the name for it, in the book. So.
Yes. Yes. And I'm also, I just was thinking, as we're speaking about this, I grabbed hold of this one as well, the Post-Traumatic Growth Guidebook.
Oh, this one?
And yeah, that one. But I wanted
right?
to read, if you don't mind, I would love to read a quote in here that feels so relevant to what we're
Yes,
speaking about,
please.
because I think that people misunderstand resilience. And
They
so
do.
this is from an area in here called Understanding Resilience and Post-Traumatic Growth. And here, what I say is that importantly, resilience is not the same as optimism, right? Being overly focused on positivity and happiness has its drawbacks.
Hmm.
Sometimes trying to stay positive can override our authentic feelings and leave us feeling ashamed about the very symptoms that require compassionate and caring attention.
Hmm.
Rather, resilience is grounded in what we call realistic optimism, which is the ability to maintain a positive outlook on life while acknowledging the challenges that will occur inevitably along the way, right? Too much realism can lead to skepticism or negativity, and that's what you're speaking to, right? Which can
Hmm.
squash our dreams or hinder our ability to move forward. And too much optimism can result in fantasy or idealism, which can cause us to turn a blind eye to the actual barriers that are present in our lives.
Hmm.
So, in contrast, realistic optimism allows us to have the dreams while setting attainable goals about how to achieve them.
Wow.
Yeah.
Absolutely amazing. I mean, and that's one reason that I love DBT, and not to go too often on a tangent, but the idea of combining like logic, emotion,
Yeah.
skepticism, optimism, like the
All
combining
in
things
those
that we think of as
dialectics.
opposites, synthesis, dialectics.
Yes. Yeah. Yeah. Absolutely. And that, like the basic one, which, we come back to again and again, which is that we need to focus on acceptance in order to move toward change.
Yeah. I love the term radical acceptance, not just because it sounds very 90s, but because it's like the basis of DBT. It's the basis and there's so many misconceptions like, well, if I'm accepting something, doesn't that mean I approve of it? Doesn't that mean that things are just going to stay the same? No, it's the opposite. When you're in denial, you don't know what it is to fix. You don't know where to start. But when you accept that this is actually happening, you can move forward.
That's exactly right. And here, what I think what happened for so long, if we tie this back to the systemic racism,
Mm-hmm.
is that there has been a collective denial. People have been wearing blinders, not wanting to see. And this is for centuries, right?
Yes.
Or there has been so much oppression of the voice that's been speaking out against this that it has allowed it to continue. And now, with technology, with the use of all of these cameras that are exposing what's been happening and putting it in people's living rooms and in their hands on their phones, right? To be able to see
Right.
so clearly, we can no longer deny. We have to accept what's happening. Acceptance doesn't mean we're okay with it, as you just
Right.
said. We have to turn toward what's happening realistically in order to be able to enact change, engage what needs to happen for reform.
Absolutely. And it can be overwhelming for people in their worldviews to look at things and explore what their own biases are. And so I think that book, I'm going to also look into that and reference that. I've heard of it, the My Grandmother's Hands book. It seems like an absolutely great work, and the
Mhm.
fact that it gets to the polyvagal theory, that's just wonderful.
Yeah,
Um,
yeah, yeah. He's wonderful. He also has a course on his website. It's because I've been going through his course on his website, and it's
okay.
lovely. You know, so to really honor what's out there and who's out there and who's speaking about this. So his
But yeah,
his website is the Cultural Somatic University, and Resmaa Menakem, and
yes.
to really honor what he has been getting into our world. So just grateful that he has been out there, and also some of the books that have been helpful in regards to white fragility, right? Like looking at Robin DiAngelo's book and understanding why it's hard for white people to speak about this.
Mm, right. Yes. Yeah, his website is his name, so that gets it.
Yeah,
www.resma.com. So there you go.
good.
Interesting stuff. I think It's very eye-opening for people. It would be interesting to see how graduate students are dealing with this stuff now, people who aren't even therapists yet but are studying. Probably a lot of
Right.
conversations there.
Yes, I was really I was really lucky in grad school. My mentor and dissertation advisor and advisor throughout my entire doctoral program. Her name is Dr. Nancy Hanson, and her specialization was in multicultural studies. And so I happened to enter into my PhD program at a time when she was doing a study on multicultural competence among psychologists and members of the APA. And so I for 4 years was able to participate in this research study, and it was very influential in my thinking at the time, and certainly still now. That was, gosh, 12 years ago that we published that paper. But it was looking at the divide between what we know to be cultural competence strategies and behaviors and awarenesses that therapists should have, and the divide between that and what's actually happening in practice. And the intention of that research study was to close that divide.
Wow. So were you a research assistant on that?
Hmm.
That's really cool. Yeah, we'll have to. I want to find that paper now. That's
I
great.
can send you, I can
Yeah,
send you a
that'd
copy,
be
and
great.
it's available through. Anyway, I'll get it.
Yeah, yeah, yeah.
It's
That's
published
great.
in
That's really cool.
the
Um,
Research and Practice. Yeah.
wow, it's very relevant stuff. I mean, if there was one thing you could put out there for people to educate themselves, or to for people who are survivors of the systemic racist trauma, what do you think you would put out there for either of those or both? I know that's kind of a big question.
It is a big question. I would say that if, I mean, I can't speak
Sure.
on behalf of someone that has directly experienced racism themselves. I can speak on behalf of my own experience
Right.
of confronting my own blind spots and a commitment to
Right.
that,
Right. That's
right?
more. Yeah.
And my own willingness, and I think that's what we want to come to the table with is how
Yeah.
can we increase willingness to have difficult conversations and to sit inside of what can feel like guilt or shame, and tolerate that in a way that doesn't spin us into toxic shame, but actually allows us to say, gosh, I'm not proud of that, or I've been benefiting unconsciously from this, and I need
Hmm.
to be willing to look at that and to make changes. So those are the parts that, that I can speak to.
Absolutely. That's awesome to hear. Just that itself. It. Speaking as a therapist, I think there's a bias and a well-intentioned one, but that's not really an excuse. But I think therapists, the way they are brought through school and what we're taught and how it's kind of an atomized approach. If you pick a school of thought, then you use some interventions and it's 50 minutes or 51 or however, but don't go over because insurance might charge the person more. You're delivering a service, you are giving coping skills, and it's essentially serving kind of a priesthood function that isn't in society, kind of a mentorship, kind of something where it's like, well, here's what to do to get better on a psychological level, on a metaphysical level. And if therapists have to sit with something they can't fix or even offer anything remotely helpful for, that's uncomfortable. And there's a competency. At least for me, if you feel you can't help someone out of something, it's very difficult for the healer and the client, right? And there has to be that authenticity there to say, you're right, I can't fix this right now, or you can't fix this single-handedly with a few coping skills. What does that conversation look like?
Yeah. Yeah, I think that's fantastic. It's one of the things that I appreciated most about working in community mental health and that I miss most now that I've been in private practice. When I was in community mental health, we worked really closely with the case management, right? And we worked closely with individuals that could, we had the Department of Vocational Rehab down the hall. We had people that were associated with housing down the hall.
Right.
It was
Yeah.
so easy to access resources for, the individuals who didn't know where to start, didn't know how to get Medicaid reinstated, or didn't know how to access food, right? And safety. So, like for some of those really basic level needs,
Yeah.
that is where I appreciated community mental health. What I didn't appreciate about it and why I didn't stay is a reason that a lot of people don't stay, which is that the, mental health providers are not compensated enough. It's kind of like childcare. It's kind of like elder care. That actually there is this disservice and a high burnout level in the most needed realms, right? The most needed arenas of work. So, the level of productivity that therapists need to meet in order to stay compliant with the demands of working within a mental health system that says that you need to have a caseload of 60 to 80 clients. I can't do the kind of service work that I want to do for a client when I say, well, I can get you in once every 3 weeks. And those were the kinds of dilemmas that were happening within that system. And at some point, it really backfires. We see this in lack of access to psychiatric care with the degree of frequency in which people are decompensating because they're not getting seen with the frequency that they need.
Oh, what a conversation. Yeah. And I think now I was talking with an old supervisor, and one of the issues is EMDR was kind of a big thing and it's now, I mean, you have to basically ask someone who wants to be a mental health specialist, okay, go through college, go through graduate school, then go through EMDR, then do all of these trainings, and then you're really doing a great job. I mean, I can't imagine doing therapy without EMDR at this point in my tool belt, but everyone can, and that gets into some systemic issues of the barrier of entry, financially speaking, to people who might not be able to. That's a whole rabbit hole that kind of connects to our conversation. But I'm right there with you. I think it's unfortunate because it's like the same thing as with teaching or childcare, like you said. It immediately comes to my mind, kind of the education system of what kind of mechanisms are in place, what's expected versus the reality of what's kind of needed. So, yeah.
Yeah. Yeah, absolutely.
Right. But all right, that is a good conversation. I want to hear how you got in. This could be, you could make it as short as you want, but how you got into somatic psychotherapy as your real therapeutic lens, or at least one of your main ones.
Great. I love that question. So, it's actually a very personal question. It probably ties together with some of the conversation we've had already. But I experienced my own childhood trauma. So that's part of it. It wasn't you know, I don't know that we can ever compare one kind of trauma to another. So mine was mine, right? But what happened was that there was some domestic conflict that occurred in my very, very early years. We're talking before the age of 2. My parents separated when I was only 2. There was a lot of dispute. I have some very vague early memories of yelling and arguing, and I've certainly heard stories, right? So I know that all of that informed my mother's pregnancy, my early attachment phase, right? Like the embodiment phase, as I like to think of it, the phase in which we start to build that sense of trust in the world from, Erickson, right? Like trust, mistrust, that feeling of it's okay to come into the body and to yield and relax and to trust in relationships. Well, all of that had a shaky foundation at a certain level. Now, my mom loved me, my father loved me. They both did their best and they struggled with each other, and all of that had an impact on me. And so the divorce was official by the time I was 4. So again, you can imagine the upheaval. They both met their next partner that same year. And so by the time I was 5, I had a new stepmother and a new stepfather. I had 3 step siblings. And so this family, and so I'll combine it with another concept here, which is the highly sensitive person, right? So as a
Good. Yeah.
very empathic, sensitive little one, I took this all in, kind of wide-eyed, like deer in the headlights. I took it all in. You can see my body language here. Whoa.
Yes. Yes.
And it was too much. It overwhelmed my circuits. I didn't have the capacity, especially not as a pre-verbal one, and certainly, not as I was developing. And no one really helped me process all of this in those first years. And so I grew very overwhelmed in my system. So it showed up for me somatically. And I would have experiences of getting chronically sick for years up until I was about 18. I would get chronic bronchitis. I was on antibiotics twice a year. I had asthma. I had bladder and urinary tract challenges. I had a lot of systemic challenges in my body. By the time I was in my 20s, I experienced brain fog. And if you're familiar with that term, or if our listeners are, it is debilitating and fatigue. But I also recognized that my diet consisted of a lot of sugar, a lot of dairy, a lot of wheat, right? And I hit what I would call a healing crisis, all that culminated around my 20s. That also corresponded with a series of car accidents. And because everything showed up so somatically for me, and, I mean, in the illnesses, but also I would get caught in my throat, in my chest, in my belly. I felt it all here. I, it was, there were 2 things that gave me relief. One was yoga. And when I was in college, I had actually grown up in a family that did yoga. When my stepdad came into my family, he was practicing yoga. He brought it into our family, and it was a wonderful early resource for me. And he's someone that I'm still very close to, right? But when I didn't practice much when I was in my teenage years, and when I went to college, I started taking yoga, and I had pretty debilitating anxiety, and that was the place where I found relief. I also, and again, very privileged to be at a college where this opportunity presented itself, and I went to it. I went to a body mind centering event. It was a weekend. And you've read about this probably in one of my books because I write about it in the post traumatic growth guidebook. But I go
Yeah.
to this body mind centering class, and you're being held by another, and they rock your head. Of course, like, we don't do this during COVID anymore. They
Yeah.
held your feet and just kind of rocked your body, and something broke loose inside of me. And whatever compartmentalization and dissociative strategies I had been using to cope up until that point, something opened up. And it was very, very painful. I cried and cried and cried. It really opened up a lot of wounding, but it also said, I like, there was something where I was just like, I want more of that. What was that, and how do I get more of that? And so it sent me on a hunt for this thing called somatic psychology, which
Right.
at the time there were, I think, 3 programs in the country that offered degree programs in this, and one of them was here in Boulder, Naropa University. And so that was how I ended up there. Changed my life, really helped me bridge the gap at every level. And it's why I'll tell you just one more piece to the story. And of course, I could talk for
Go
forever
ahead.
on this story because
That's very inspiring.
but one other piece that I would say is that not only did the embodiment practices were they central and crucial, but the healing relationship and feeling safe with another person to go to those very kind of quarantined off places in my psyche, and then also to tap into the other lifestyle changes that I needed to commit to in order to heal the illness, right? The illnesses that had kind of settled into my body. So I changed my diet completely. You know, this didn't happen until I was maybe 28. I reduced sugar. I stopped eating wheat. I stopped eating dairy. I committed to a daily yoga practice. Like there were all of these pieces that I realized, like, that for me to feel balanced and grounded, I had to commit to at a daily practice level, not just the once a week therapy.
Uh, that's absolutely amazing to hear. I know yoga is such a big part of your own practice, and you do some inspiring yoga conferences. I'll see on your Facebook page. You'll ally with other yoga instructors, and it's another inspiring thing that people can look at. I have so many clients who are wondering how to stay even hopeful for life now, and so immediately what comes to mind is safely exercising, safely doing something like yoga, watching an instructor like you. It doesn't have to stop just because we've been inconvenienced. We can find creative ways, and sometimes we have to do that.
Mm-hmm.
And that kind of segues into how we can maintain mental health in the wake of COVID. I mean, at this point, that's a passe question because anyone who works tangentially in the healing, helping professions has been asked that. But I think the answer has to be very authentic, and it kind of has to change as we're in different phases of the collective trauma.
Yeah.
If people don't even feel like moving, they need to just sit with their anxiety. That's great, as long as it doesn't turn into really giving into that and getting outside your window of tolerance. But
Yeah.
yoga is such a great way to stay mentally and physically healthy right now.
Yes. Well, you named something important in there too, which is that it's a collective trauma. And that tapping into just the words, you're not alone. You're not alone. There are other people that are experiencing the effects of this. And while on the one hand, that might feel overwhelming, on the other hand, it reduces isolation, especially at a time when we've had reduced social contact. And to tap in to some form of community or group gatherings where there is a chance to feel connected to other people. I ran a few weeks ago, and I'm going to run this again on, I don't know when this comes out, but I'm running it again here on July 21st. And I'll probably run another one in August because it's just been a really powerful process. But a few weeks ago, I ran what I called a community gathering, which just had people come together in a webinar format and just share a little bit about what is it like going through this collectively, and then guiding us through some somatic practices and some mindset practices to help us feel more connected and oriented toward the healing process that's available even during this time and necessary for sure during this time. But that feeling of connecting with other people in a mindset of intentional healing is profound.
It absolutely is, and I hope to share that in the coming weeks. That's great. I'll share that online because people are definitely looking for answers. So I want to give a few minutes here to ask you, who would you have a conversation with? Which three people, living or dead, or any combination of it? I like
Oh,
to ask that question. It's kind of my Foxed In trademark. I got it from another podcast that was more philosophy based, but I think it's a good question because it's kind of like a Rorschach test of people's, you know, interests.
what a rich question. It's also a challenging question. Um, well, I'm pausing because I'm really trying to hold this question in
Yeah,
the midst of this
of
current
course.
conversation, right?
That's
Like,
that's kind of the
and I don't think it's just the kind of Rorschach of an individual, but it's a Rorschach of the individual in the context of the current
ab,
climate, right?
yeah, and yeah, absolutely.
Yeah. And so I would say that, if I could go back in time and sit with Nelson Mandela and understand his capacity for forgiveness, that would be a pretty amazing conversation. I would love to have a conversation with Alice Walker. and and just sit and hear. Like it brings tears to my eyes, especially because her books have been just really powerful and meaningful. And I remember this actually was just the movie version, which I don't even think captured the book. But when I was in high school and I had watched The Color Purple, and
Yes.
that broke me down to, like, it took me to my knees. I sobbed like I had never cried before in any movie that I had ever watched. And there was something about really seeing what it's like, you know? So, and, Maya Angelou. I think those would be my three, right?
Yeah.
Like, let's, and again, it's a reflection of the here and now. But, to have that conversation, to have a conversation and just say, like, teach me, help me know, what's it like from your worldview? And, you know, my own openness and willingness to sit in open-hearted curiosity.
Absolutely awesome. Yeah, that's great picks. All with something great to teach. So, where can people find you? Where should they follow your stuff and get more information about this, about resilience now? Obviously, your book is on
Yeah.
Amazon.
Yeah, they're all out on Amazon. They are, I would say, come to drarielschwartz.com and
Mhm.
follow my blog because I'm always putting stuff out there, and you'll find out about conferences and I am invested. This is part of my kind of give back to the world and community, but I am invested in sharing information freely or as low cost as possible. And so, my blogs are out there. And then I put little videos of yoga practices. I have free embodied yoga practices up on my website. And if you're on Facebook, come join me at Dr. Ariel Schwartz on Facebook. I have other social media platforms, but that's my biggie. And that's the one where I am most interactive.
There you go. It's absolutely awesome. Take it from me, and I'll attach your polyvagal theory article to the either in the comment to the YouTube description of the YouTube video, and the podcast in there where people can look at the description of that too, because I think that really goes into some cool stuff, and we didn't have time to get to that, but you explain it very well in your blog. So
Well, thank you.
awesome. Well, thank you so much for joining us.
Yeah, it's a pleasure to be with you, Jeremy. You take care.